Good evening, everyone. 7 o'clock has finally arrived, and so we can start our meeting. Just so that people who were watching in know, Kay Guild is a guest here tonight, not a substitute, because she's interested in the agenda, which is absolutely fine. Thank you for coming, Kay. Right, item number 1 on the agenda is 3 lots of minutes. So the minutes first are the ones of the 3rd of November. Are you happy that I sign those as a correct record of the meeting?
Sorry, Chair, we haven't done apologies.
Oh, sorry, it's because everybody's here. Do we have any apologies?
No.
Thank you very much. We're all here. Right, back to the minutes. Are you happy that I sign the minutes of the 3rd of November? It seems a long time ago now. Yep. And then the next one is, I think, the 3rd of December. Okay. Thank you. And then the 17th of December, which seems like yesterday. Didn't sign that one. Okay, are there any declarations of interest? No. Any public questions? No town and parish, no councillor questions, thank you. Winter pressure preparedness, item 45. Oh, sorry, I'm looking at the blinking minutes now. Yeah. Voluntary and community sector prevention contracts recommissioning. Not sure who's doing this. Wesley, you. Thank you.
Thank you, Chair. So I'm Wes Hedger. I'm the Service Director for Strategy, Transformation and Commissioning within Adult Services. I'm joined by my colleague Helen Brown, who is the Commissioning Manager for Early Intervention and Prevention Services within Adult Social Care. And we are coming today to talk about the community wellbeing and prevention services within Adult Social Care. The paper itself outlines our approach to recommissioning services within adult services. If we could move on, please, Helen. So community wellbeing and prevention services within adult social care. We've got a statutory duty to prevent, reduce and delay within adult services, and we work very closely with the voluntary and community sector to commission prevention services within Wokingham. We've got current contracts which are expiring, and we're looking to procure the sector again in March 2027, and we're seeking executive approval on the 26th of February. So we are looking for Health Avenue and Scrutiny to support that procurement activity. So in terms of early intervention and prevention, we're keen to work with our local partners as the experts within the sector. And this is about improving well-being and supporting people to have improved outcomes within the community and support greater community cohesion, resilience, good mental health, well-being, and support people to thrive, live the lives they want to lead within Wokingham. Total spend is 2.6 million currently, over 25 contracts, and we are looking at contracts of a 3-year period plus 2 as part of those contracts. And then move to you.
Okay, so we just...
Is this in a supplementary agenda? Because I haven't got it on. Yeah, I can't read that because it's too small. We haven't got any of this in the paper.
So sorry, we just put those together to support the discussion in terms of this. This reflects the detail included within the report
we can't
itself.
read it because it's too small. Well,
Okay.
in my eyes.
Okay.
I mean, I'm not expecting you to then read
Sure.
every single box
think,
to me. But
yes. So this what we're trying to demonstrate here is we won't go through it all, but this is just the community impact that our voluntary sector and the community sector is having within Wokingham. These blue boxes there demonstrate those contracts and the level of service, the level of residents that we're supporting in the community, and those services that we currently commission under those 25 contracts. We can obviously provide that after the meeting.
Could you email it to everyone?
Yeah. Yes. Yes. Yeah.
Okay. So, as Wes said, that was just some information about the impact that the contracts have. We also just wanted to share here just some thoughts from people who are using the services currently. And as you can see, there's some really positive outcomes that the services give to people. We'll share this so you'll be able to read that through. We also just wanted to talk to you a little bit about the work that we've done to prepare for the recommissioning. So we've done something that we call a needs assessment, which looks at the need in the borough now and in the future. And we've made sure that we've involved all key stakeholders, including residents, in these discussions. And that's included some surveys, some data and insight, and some personal insight from people as well, so that we know that what we're commissioning is still right and still relevant, and look to see if there's any kind of gaps or anything in the current services. So all of that's been taken into account when we reissue the tender, which will come out in May this year. And the final one was just a timetable, just to give you an overview of how the rest of the project will work. So at the moment, we're in service design stage, where we're looking at all the different service specifications, making sure they're still fit for purpose and relevant, making sure that we cover any gaps. Then we will finalise the tender in April. It will go out in May and June. Evaluated in July, and award the contracts in September. So there's plenty of time before they run out at the end of March. So everything's ready to go for April 2027 for the new contracts.
I'm going to ask you a question about the availability of the services to fulfil the contract. Do we think it will be easy to get the best service, or are we unsure?
Do you mean in terms of providers that will, yes, no, I don't think we'll have any problems. I think there's lots of organisations out there, some of the existing ones and potentially new ones as well, that will be interested in taking on the services. As you know, we're really lucky. We've got a really thriving voluntary sector in Wokingham with some excellent people and organisations out there supporting our residents. So we're confident, yeah.
sorry, so just to be clear, because I've read through what you sent through, but none of this it doesn't fully match up. So you're going to be tendering for different services, and you'll be expecting the voluntary service to tender for them. So groups like Citizens Advice and all that will be, and you will be paying them to run a service for you.
Yeah, so
Yeah.
apologies, we intended the slides to be an aid memoir to the paper. But yes, this is adult social care related commissioning services within the voluntary sector to support adult social care. So not beyond the wider council's voluntary sector strategy, but this is very much related to adult social care and our Care Act responsibilities.
And I'm sure you're obviously aware some of the voluntary sector is extremely stretched. They don't have much money either. A lot of these charities are going to other charities for funding, for grants to, obviously this will promote that for them if they're obviously being paid for a service, but they've also got to have the volunteers to provide that service. So when you're looking about giving these services out, saying to whatever group want to take them on, what kind of due diligence are you doing as such to make sure that they can provide what you're asking for? Because I'm quite heavily involved with Woke United Charities, which is involved with citizens' advice. And I know they are struggling quite a lot at the moment with various issues and funding and staffing. And so there's quite a few issues. There's a lot of voluntary within Wokium that do a hell of a lot. We're so lucky. But it's quite thinly spread. So there's a lot of, sorry, kind of going on a little bit there. So how are you going to make sure that they're able to fill those gaps that you need?
So in terms of the funding, yes, it's tight, but in Wokingham, we provide an uplift which is aligned to the wider social care sector in adult social care. So we provide that annual financial uplift. I think last year was 4.4% uplift in terms of the sector. And we very much look to work with the voluntary sector in Wokingham for adult social care in the same way as we look at the wider sector and how we can support financial sustainability. And we have regular contract management meetings where we're talking about both the performance of the contract, but also financial sustainability and how we can work closer together.
Mike.
Yes, thank you, Chair. So at 2.6 million, this is a relatively small proportion of the whole adult services budget, I guess. You've got 25 suppliers, kind of everybody's doing something unique. So, and you're talking about a tender, so is this a detailed specification unique to each organisation? And if it is, then how do other people find out about it and decide whether or not they can bid for it?
So it's an open tender process, and we will be working, it goes through, the system is called Pro Contract. So those contracts are, it's a procurement portal whereby we publish tender opportunities, and the sector is supported to bid for that work. So it's an open procurement process. So it's not a grant. We've moved away from grants, and it's an open procurement process. And we have a specification process and an evaluation process, which is linked to the services that we're looking to commission.
So I'm kind of wondering, on average is £100,000 per organisation. How much is the tender process costing for this, as opposed to just going through a grant application process?
So we've moved away from grant process to provide both openness and transparency in terms of commissioning activity, but also it enables us to provide greater longevity of funding that the sector has asked for through so we wrote a voluntary community sector strategy with the sector. We co-produced that and they co-wrote it, and this is something that they very much supported in terms of moving towards longer tender activity through a commissioned process. There will be obviously support to organisation through that tender process.
Because there's also a cost for the organisation responding to the tender to respond to it as well. They might evaluate it, it's not worth the amount of money we're likely to achieve.
I'm sure that may be possible, but we feel that in terms of a tender process over grants, there's greater merits to a tender process. And then with it, again, there's support available to individual charities that are tendering for work.
Wesley, can I go back a bit and look at how many years we've been doing this process? Because Mike's new to the committee, so this is all new and different to his background, and how it's worked before in that mutually beneficial way for both the organisations and us.
Yeah, thank you. So in terms of the mutual benefit, we've recently inspected by CQC, and this is something that was very much applauded by CQC. We received outstanding in terms of our partnership working, and that really reflects the partnership between the sector and adult social care working together against joint objectives. And as Beth said, we've really moved away from grants, providing that financial sustainability for the sector based on procurement activity which delivers against our objectives. And again, we worked to develop our adult social care, voluntary and community sector strategy with the sector to make sure that we're aligning against their objective. So in addition to the way in which we commissioned that came out of that strategy. We saw other developments within Wokingham, like the voluntary sector hub, bringing voluntary sector closer together and supporting them to work with adult social care, work together with adult social care. I don't know if you have anything to add, Helen.
So the current contracts are in their fourth year at the moment and have all been going really well. We're really pleased with the performance and the impact that it has on people and local residents, because they are the right people to deliver the service. They've got that expertise and knowledge and the trust with the residents. So we know that it's something that's really well used, really well appreciated and valued. So it's something that we want to continue because we think it makes a massive difference.
Any more questions? Okay, let's move to the vote, please. Can I have a show of hands to agree that this goes through? Thank you very much. Item 66 on page 25 is the Adult Social Services KPIs. Who's going to do? Wesley, is this you again?
Myself again, thank you. Bear with me. So in terms of the Adult Social Care Performance Report, you can see that there are 9 KPIs reported within the report, one of which is amber, 8 are green. This is for Q2 in terms of the KPIs. And I think overall you'll see, in addition to the performance, there's obviously a notable rise in demand within the figures, which you can see throughout the indicators. And happy to take any questions relating to any of the KPIs.
Rebecca, it's your turn.
Sorry. When we spoke last time about these, we spoke about specifically the CQC registered providers that are rated good or outstanding. And am I right in that that was the one where we were talking about you taking on the new care home? Just getting an overview of how that is going, whether that's related to that or not, because this is a registered provider. I'm not sure if that comes under that one, when you'd taken on the new property and then when that was going to be re-inspected.
Is this Bluebell?
Yeah, that's
specifically?
it.
Okay.
Yeah.
Yes, I mean, Bluebell, I think, is a really good example of how this KPI is working out. So this is bound by CQC doing inspections. And in the last 2 quarters, that you'll see the data hasn't changed. And that really relates to CQC's capacity to complete inspections, changes in the framework and how they're prioritising inspections. So Bluebell House has not been inspected, and it's been 3 years since its last inspection. So we know that, unfortunately, there's not going to be significant change in this KPI from a statistical point very, very frequently. I think that's, well, it's not. One of what we've put in place because of that inspection regime is our quality assurance framework and how we quality assure our provisions locally and make sure that we are supporting providers to improve and get the best outcome. So Bluebell House, there has been significant improvement in terms of the quality. We've also seen significant investment in terms of the refurbishment of the home, which obviously coincides with that improved quality. Yesterday, I think we were 96% occupied at Bluebell House, which for a care home is very good. And we get lots of positive feedback from those local residents living at the home.
So basically that does indicate why there's no change in that KPI.
Yeah, there's no change in the KPI because CQC haven't.
You would think logically with CQC that if you had a new operator, that it would be inspected pretty soon, and well, you would do if it was a school.
Yes.
If there's a change of head teacher, you get your Ofsteds brought forward. You used to, didn't you? Not anymore. But yeah, you would think logically if you've got a new provider, and it'd be good for you to be able to get that inspection.
It would be
done,
yes.
And then you could improve this, but it's out of your hands, isn't it?
It is out of our hands in terms of that, and again, it goes that they select who they're inspecting, and unfortunately, they haven't picked Bluebell House to inspect at this stage.
KPI AS8, which is about the percentage of people discharged. I mean, it was worse in the same quarter last year as it is this year, but is that just seasonal because it's the autumn when people are getting coughs and colds and end up being in hospital longer?
Sorry. Part of that is you'll notice in quarter two, the numbers are a lot smaller, and that relates to the scheduling cycle of reporting here, but also the data comes directly from Bob, and we've only received 1 month of performance data relative to quarter one, which is 3 months. So we'll have a better picture next quarter. Unfortunately, that's down to the reporting cycle itself. But we have seen more complex cases involving people with learning disability and their ability to go home, which will impact slightly on the performance. But unfortunately, this is not a like-for-like comparison with quarter one at this stage.
Okay, and looking at some of the other KPIs, we're either way above target. AS1B is a good example. Does that not mean the target needs moving? Same would apply to AS5, perhaps.
So again, with AS1B, you'll see in quarter two that demand has increased. So I think in terms of the performance, it's positive that we've remained above target at this stage. And so we've seen both an increased demand, but also being able to manage that performance. So I think at this stage, as we're seeing that increased demand and pressure on KPIs, that's reflective. I would say going forward, the government is changing some of our KPIs, and that will be in the future. Something we will be looking at is our set of KPIs that we have here and making sure they align to government requirements. And that will probably come through in quarter one for next year.
Okay, and AS2, the 26%, we're a long way from where we were in quarter one, 24-25, where it was 39%, we're now down at 26%.
Yeah, AS2, so lower is better in terms of this indicator. However, we do see a lag in the recording of this. So this will be the information that's reported. Oh, sorry, I'm looking at the wrong one. I do apologise.
Yeah, because that doesn't make any sense.
So I apologise, yeah. So sorry, could you repeat the question because I was on a completely different KPI?
Yeah, okay. Percentage of new contract referrals closed with advice, information and signposting. So the last 2 quarters have been 26%. If we look at the same kind of period last year, it was much higher. So why is that?
So you'll also see, again, the numbers have increased significantly in quarter two. So we're up from 719 to 1,007. So again, this reflects the level of demand within the service.
Yep.
And we've been able to maintain performance there. So again, positive that we've been able to maintain that level of performance given the increase in demand.
Okay. Thank you.
Any more questions for Wes? Oh, sorry, I pressed it the wrong way. A show of hands, please, to accept the report. Thank you. Let's move on to item 67, which is the public health KPIs. Caroline, I guess you're taking that one.
I am indeed. Thank you. Good evening, everybody. So these are the headed quarter two public health KPIs, but they are in fact quarter one KPIs, and that's because of the data lag that we have. So this paper goes to Overview and Scrutiny Management Committee, and this is a subsection of that committee. So the timings are unhelpful in terms of it being the quarter two KPIs. So quarter two KPIs will come to the next Health Overview Scrutiny Committee, and unhelpfully will be called the quarter three KPI report. It's just, I know, it's just the data lag, I'm afraid. We have 9 key performance indicators in here, and there are two of particular concern. We've got PH1, which are mothers who receive an antenatal contact from a health visitor at 28 weeks of pregnancy. So that's before birth. Is very poor. We also have an increasing proportion of adults in drug and alcohol treatment with an unplanned exit. So both of those, we have put measures in place to try and address those. But there's probably some things to talk about with regards to the face-to-face antenatal contact, because that is incredibly poor. It's about 10%. Our target is 75%. That's extremely aspirational. I mean, obviously, we'd like everybody to have a face-to-face contact with a health visitor at 28 weeks. Our target is 75%. It's a self-set target. This is not, there's no national requirement about this. If you benchmark against the rest of the South East, the achievement is 35%. So there's definitely some work we need to do about exploring how we've set these targets and what our aspirations are here. Yeah, Melanie.
Oh, sorry. What is the reason for that? Have you found out? Is it just they're not engaging for the antenatal, or is there some other reason?
So some of the other reasons are that we offer an online contact, and so people can sort of choose to take that up or not. There's a data issue, and we're not convinced that the data we're receiving is fully accurate. The other element is that women who are pregnant tend, they're doing their other stuff. They may have other contacts with healthcare professionals, so they don't necessarily see that as a particularly important element. But these are all questions that we're exploring in more detail with the midwifery service.
Rebecca.
Specifically about PH1, and I do say, you've got 9 KPIs and 2/3 of them are all worse, which is slightly concerning, if I'm honest. At PH1, the health visitor, I remember speaking to Jyoti about this at the time, and she very much said to me that it was due to we pay less, and Bracknell achieve a lot more because they pay more per head, per woman, as such, per pregnant woman, and that there was going to be extra funding going into this. So what is the actual case then? Is that correct, that we have increasing our pay per head per woman? When do we expect to see a return from if we're paying extra? Because I think there was a difference between us and Bracknell of about £10 per woman. It was fairly significant. And yet the amount of women they're reaching is huge against us. And I just couldn't believe there was such a disparity between two areas. So is that something you're aware of or that you're working on? Or?
Sorry, can I just, for clarity, who is the provider?
The provider is BHFT, Berkshire Healthcare Foundation Trust. I haven't done personally, I haven't done any benchmarking against Bracknell. We currently have a shared contract with the 0 to 19 programme. So this is for 25-26 year. We're reprocuring the service going forward from, I think this contract ends in March 2027. So we're going through a process of reprocuring the service. And that will help us have greater control over exactly what's happening with our contracts. I'll have a look. I'll go away and have a look at the benchmarking. I'm not aware that we fund a per head basis like that. We have a contract to deliver a service. So I'll have to go away and investigate that further, Rebecca. I can't comment here.
So obviously this has been discussed before at Scrutiny. And I brought it up with Jyoti in one of my meetings then. So it's just concerning that it's actually worse, because I was hoping, because she made it abundantly clear to me that it was a service they would be really investing in to try and push it forward, yet it's worse.
If I could just add to that, I think one point to look at is whether they're first or second or third or fourth time mothers, because I think once you've had one baby, you sort of know a lot more and you don't accept quite so much advice. So if you could add that into your thoughts with Bracknell. Oh, yeah, sorry, yeah.
Sorry, can I just come back to
Oh.
Rebecca in terms of,
Yes.
so the funding for this 25-26 would have been set. We have no additional funding for 25-26. So it would have to be going forward. We have an incredibly small public health grant as it is. It's the smallest in the country. So we have to take all those elements into consideration. But any additional funding that goes in would have to go in for the next financial year. So.
Mike?
Well, I think Caroline has answered what I was going to ask, but I mean, I am staggered that, or I'm really concerned to hear that Bracknell has a much better achievement rate, and that it might be just how much we're actually paying, because the provider isn't going to try very hard if they're not going to be paid very well. I guess that's the obvious corollary.
So that's very much about how we are managing that contract. We've done a lot of work with BHFT to try and understand the data better and to get better data, and that's a work in progress.
So isn't it a simple question to the Berkshire Healthcare Trust, who are providing the same service to Bracknell and to Slough and to Reading and West Berkshire? Why are they differing in their delivery rates? It's just not sensible.
Might not be sensible, it's opportunist, isn't it? See if you can squeeze some more out of the authority, and one says yes.
Let me go away and explore that situation with
Could we
Bracknell in
explore
more
that
detail.
more with Berkshire Health, so that we've got an idea of what
Absolutely.
the other 5 unitaries are achieving? Because this is, I'm really surprised that people at 7 months pregnant have not seen or spoken to anybody about antenatal care.
Anything more? Okay, are you happy to accept that? Oh, sorry, Alison. Yeah.
I'd like to ask about PH9, the only item on the agenda where we do have data for Q2. Now, I know it's got a green rating, however, there's no direction of travel on there, and direction of travel is clearly worse in that in Q1, it was 53%, and then in Q2, it fell down to 29%. Now, when I look at the graph, I can see it did go down a lot in Q4 and it came up a bit in Q1. But, well, actually the graph's slightly confusing. But could you just explain a bit more about PH9, which is about community wellness outreach to a targeted group of non-white British, why it's fallen to 29%?
Well, also, why did it shoot up to 53 previously?
I'm sorry, I didn't catch that, Mike.
Sorry, just to add to what Alison's saying, it shot up in Q1 to 53% from 31, and then it's dropped back to 29. So was that 53 an aberration?
So there's been a lot of work going on with community wellness outreach sessions to try and increase the number of enhanced checks that they do. And this is about targeting. Could you speak to Oh, sorry, is it not coming out? Sorry. Is that better? Yeah, I can hear it better as well. So the community wellness outreach team, sorry, that's really loud now. Community wellness outreach team has recently been brought into the public health team. It's funded through the ICB to undertake enhanced health checks. So there's an NHS health check, and this is to undertake the enhanced health check with specific targeted cohorts. So we're looking at men, because they are less likely to attend for screening, for black and racially minoritized groups, and for people in areas of higher deprivation, sorry. So a lot of work has been going in to develop that programme and target those cohorts. So as it is going up, and continues to increase in those programmes. The 29% is a bit confusing to me. I don't know where that's come from. My understanding is, yeah, exactly. Exactly. I think there's, oh, it's on the other side. Yeah. So the invites identify the cohort for the year. So what looks like has happened here is it's been front loaded. So we have our target population to invite for a health check for a 12-month period. So it's about looking at the annual data rather than individual quarter data. So that's why it's so different for that.
I don't really follow as to why, you know, say it's only 29%.
I think it's a poorly reflected graph. So what happens when we identify the cohort, that they are extracted from the target population is extracted on an annual basis. And so the invitations go out on that basis. And so people can be targeted. You have to think about an annual picture rather than a quarterly picture.
It sort of feels like this KPI is not working then, as a...
I don't think it's working in how it's reflected here, no.
It doesn't really work, perhaps we need to look in future to changing this one.
Yeah, that's a really good point, Alison. And what we're doing is we're looking at our KPIs for across the patch, because actually I don't think these adequately show us what the picture is like in Woking Borough Council anyway. We do have our equality indicators, and those are really helpful in getting underneath. But even then, I'm not sure that we're looking at the right things to do that. So I think that's a really good point, and it is something that we are doing currently to get the right KPIs in here. I mean, I'd like to see the health checks in here as well, so that we've got our normal health checks and our enhanced health checks, so we get a full picture of who's having that check.
Caroline, we won't stop you from improving it at all. We're very grateful because we've had temporary staff for a while. It's not always as good on a permanent basis to show you what you want to see. So if you can improve it, especially so that we understand it better and we get better targets.
Well, and I want to understand it better as well. And I think that's something about having someone in, because it's a cyclical thing. You know, we need to have that whole cycle to fully understand what's going on. So we absolutely are committed to improving these KPIs and making them more relevant. And I will bring back Q2 with even more information for you.
Could you put some sort of timescale on that? Because it's quite a big job for you.
So we're committing to reviewing our KPIs for the next financial year. So that will be 26 to 27. So those will have to be in place by March.
Yes, I was just wondering how you reach out. I mean, is it individual letters to people, or? So are you involving also some of the, it says particularly black and racially minoritized backgrounds, so you're involving people at the Gurdwara and the various mosques to try to encourage their congregations to get involved? You are? Oh, good. Okay, thank you.
Yeah, absolutely. And this is all about being out in the community and working with our community colleagues and the locations of where the where the checks are undertaken are important as well. So it's absolutely the case.
Can I just say thank you very much for wanting to make the KPIs good for you and good for us, because that's something which is important. And certainly I'd like to say, since you joined, I've seen you've been working very hard, and sometimes I've emailed you at funny times in the evening and got a reply straight away and thought you shouldn't be working then. But yeah, so thank you very much for all you do, because it is realised, and thank you for that.
Alice, did you want to ask a question here? Can't quite see your hand, you're very small.
Can I just comment on what Caroline has said about the outreach? Can I just say that Wokingham has worked really hard to reach to the communities, and in fact, you know, the engagement has been one of the ones that's been outstanding, especially when our borough has been considered as one of the rich boroughs, and there are hidden inequalities. So I would say the community wellness has done a really good job.
Thank you.
No? Okay, you happy to accept this report? Please, may I have a show of hands? Thank you. Next item on the agenda, of course, is Alice. Nice to see you, Alice. Would you like
Thank
to go
you.
ahead?
Can you hear me? And I'm sorry, I don't know why I'm small. Can you hear me? Is that okay? Yes. Okay. I'm sorry that I'm not there tonight, but Madam Chair, members of the committee, thank you. I'm pleased to provide you with a brief update of the Health Watch Wokingham activities and the key issues raised by residents over the last quarter. Firstly, our top teams have been and remains consistent to the wider Berkshire system. And the three main services issues people have reported to us have been access to GP practices, challenges using or navigating the NHS app, and issues relating to general outpatients and hospital-based consultants. In terms of organizations generating a large number of feedbacks, Royal Berkshire Hospital continues to feature prominently, along with primary care, especially GPs, which is changed, is now Woodley Centre Surgery, Woos Hill Medical Centre, and Wokingham Medical Centre. And primary care, as I said, continues to be significantly of concern, forming a substantial part of our legacy program. So I've also shared with you the other two surgeries that have become been highlighted to us as of concern, which is Loudon Vale and surprisingly Brookside. Due to the NHS app engage survey, our engagement has been really, really strong. So just to share with you, we've had over 1,000 feedbacks about the NHS app, and if not, our deadline is only till the 31st of January, and we've already had over 1,000, and it's been quite an interesting feedback. So we have now been approached by the health service journals to share our insights of what we have found with the NHS app. And due to the feedback that we had with the NHS app, we've also provided an information page for people to understand step by step to download the app, which we've also been told that services like the GP services are struggling because they don't have capacity. So we've been helping in that way, and also the services that have been provided in the libraries are not frequent enough for people to engage and be helped. We continue to build our volunteers base and still continuing, and also we are still continuing to do we are still here and listening campaign, because we've been informed many times that apparently Health Watch is going. So till today, we don't know when we will be dismantled, as they call it, because we don't know. And we are hoping for the King's speech, and which might be, from my understanding, in May. So that's where we are at the moment, and we're continuing ahead with our work. And primary care and NHS app includes to be the target surveyed work, women's health, community connectors program, especially with the South Asian communities around health literacy, because one of the findings in our report has been that the women in Wokingham from the South Asian community have got a good command of English. However, they struggle with the what is being shared because of the terminologies, which I think most of us do. Maternity continues to be a topic of interest for us, especially postnatal mental health checks, whereby we've just also working with Royal Berkshire Hospital. We have been told that there is evidence to show in their last survey that the GP conversation with women at 6 weeks postnatal care has been very poor. So we are working also with the Primary Care Alliance to try and close that gap. So we'll be speaking to the practice managers of each surgery to find out what is going on and how it can be improved. And I think that's where I'm happy. I would like to work with Caroline in public health to see whether we can close this gap as much as possible. Then men's health includes, so we are now doing a lot of consultation. We've been asked by NHS England to help us to disseminate information about the consultations they are doing. So at the moment, since I wrote this report, we've been asked to look at the prostate care screening, maternity, the National Maternity Investigation for Evidence, and also accessible information standard. Emergency department usage and waiting is still also on our radar, because we've also been hearing about a lot of people being on trolleys. So we will be having a conversation with Royal Berkshire Hospital about that. And our youth is also doing a lot of work with regarding the NHS HAP, and in fact they've engaged with the youth council at Wokingham Borough, and we've had loads of feedback. And one of the feedback has been technology is not the problem. The process of getting into the surgery and getting the information to how to use the app was the issue. So we are going to be looking at that as well. And as everybody is aware, the NHS 10-year plan is out there, and also that's lots of conversations are taking place about the integrated neighborhood partnership. And so we will be involved in a co-production about how to engage with the public, with the council and the NHS. And finally, our system branding in health and social care is still a progress, and that's going to be related to the reasonable adjustments, because we've been finding that a lot of people say that they have turned around and told the surgeries or systems or other the local authorities that they have issues with access and to be given time to absorb what information has been an issue. So we are looking into that. Chair, that concludes my update. I'm happy to take any questions.
Alison.
Hello, Alice.
Hello.
I wonder what Health Watch could do to help improve, the amount of women who attend their first antenatal contact for health visitor. Because I know the actions taken are about improving the content of a letter. So this is a letter that goes out. And you also spoke, Alice, about getting feedback about health literacy and people understanding the information they receive in writing. So do you think there is something that Health Watch could be doing, to encourage more mothers to take up the opportunity of an appointment with a health visitor?
I think that's one of the reasons why when I heard what Caroline had shared, and I think that's something that we can work with at the moment, and it's a good time, to be honest, because now Royal Berkshire Hospital is involved with us, along with the Maternity Voices Partnership as well. So I'm happy, and we possibly could work with Berkshire Healthcare Foundation as well. So I'm open for that.
Any other questions?
Thank you, Iris, for your review. But I'm slightly at a loss as to what the map's supposed to be, and I can't make any head nor tail of it because it's definitely odd.
So the map is showing where all our engagements have been regarding all our engagements. So that is the map of Wokingham. And, one of the things that we've always heard that, we don't know, HealthWatch has not been doing a lot of engagements. And this is evidence of how much engagements. We've done over 35 engagements so far since October.
It's definitely not a map of Wokingham I recognise. I think it's actually 108. It's negative. Yeah, it's the wrong way around. So I was trying to understand why Trinity Church Lower Early's got 3 locations, unless it operates in 3 locations.
Okay, I take the point, kind of thing, but
The other thing is there's nothing at all on it for Woodley.
well, okay, I take the point. Sometimes I think map is not a good thing either. So maybe writing it all out might be a better way.
Do we have any? Sorry, Alice, go on.
No, I was trying to make it visual kind of thing, because sometimes people do say that writing is also, text is also too much. So I was trying to accommodate regarding reasonable adjustments.
Any further questions for Alice? Alison, you're looking puzzled.
Yeah, this map is very odd. I can't work out how early Wokingham and Bracknell, how they can be that way around, unless perhaps it's been mirrored, or you have. I don't
think.
know.
I'll take the point, and
Alice,
I'll redo the map.
Alice, could you say you put it in there to see if anybody had read the papers?
That's the point.
That's why it was there, if you remember.
Yeah, I know. I did ask once upon a time, do people ever read our report? Thank you.
Mike.
Sorry, yes, just going back to your bit on primary care. So you've got 5 practices there, top 5 practices. I assume this is top 5 practices people are complaining about. Do you? Yep. So people are complaining about those, but what about all the people who think they're actually getting a very good service from these practices? How do you?
Well, I mean, the thing is that we encourage people to share with us positive messaging, but we don't seem to get it, because I think a lot of that goes to the surgeries. So we only get people who have access, who have difficulty accessing, or they want certain things sorted.
Thank you.
And this is what we hear, and but we know. I mean, this is the thing that when I first came into this post, I'm sure Councillor will turn around and say that Wokingham Medical Centre was at the top. Now it isn't. So it has changed.
Alice, is there any way that you could ask for positive feedback to give a balance?
I mean, we try. But no, it's up to. I mean, we always, in our messaging out to the social media and in everything, our printed materials and everything, we ask for positive and negative. In fact, we don't even say negative. We always say challenging feedback. So I can ask, but I do think that we can see a lot of the time. We also see you can get a lot of feedback from the Facebook as well, and you never, very seldom do you see positive. But we do share this information with the surgeries as well, and that's when they turn around and say that their feedback from the friends and family has been positive. So we know. So I suppose what I could turn around and do is the next time I come say, this is what we are hearing, but the friends and family from the surgeries have been, they've had so many numbers. Okay. I could do that.
Okay, lovely. Thank you. Mike?
I was going to ask exactly that. Could we have some sort of short report on what the surgeries think they're achieving as opposed to what the odd individual? Because the only people who are going to complain are the people who think they've been hard done by. But I suspect that's a very small proportion of all of the cohort in each surgery.
But however, sir, what has also happened in an entrant view we did some time ago, we had 65% of people were happy with that particular surgery, but we should not forget about the 35% who were not. So, I think sometimes people do forget the negatives too, if everything is positive. So, we need to find a balance.
Lovely, thank you. To receive and vote to accept that report. Thank you very much.
Thank you.
And now on to the forward programme on page 59. Yep.
Excuse me. So we've got one final meeting left for the municipal year. As you see, we've got a few items on there. I believe that South Central Ambulance Service might slip to the new municipal year. We'll talk to them, but initial thoughts is March is not the best for them in terms of reporting. We've also got a new, thank you, Beth. We've got a new item on lessons learned about the rehabilitation programmes, just to give members a clearer picture in terms of that situation. Did anyone have any comments about any other items on there? Carolyn?
Yeah, I'm hoping to push the Marmot update to a subsequent meeting to accommodate the fact that we've got we've extended the Institute of Health Equity contract to the end of June. We're also doing some work around the neighbourhoods, which feeds into it. So you'll get a much more comprehensive report to fit in with neighbourhood planning if we can slip that to a subsequent meeting.
Could members just confirm that you'd be happy with that?
If it gets us a better report, I think it's worth doing. Yeah.
Does anyone else have any other issues or comments that you want to make?
In the minutes we approved of our last full meeting on the 3rd of November, which unfortunately I couldn't attend, the minutes say the January and March meetings have heavy agendas. Now, today's agenda is not heavy, and the March one is not exceptionally heavy. What did we lose from today's meeting, Madeline, that should have been on the agenda?
I'm trying to think. I know that some things have moved around. I can't think off the top of my head without checking what has gone from today. Bear with me. I think there was possibly some policies that were penciled in, which the deadlines have shifted to later. So in January, they were looking fuller, but as you say, timelines do change. So we certainly could have additional items in March if members wanted it.
Is there anything on the action tracker that we need to look at?
You've got the item about Royal Berkshire Trust Update, Building Berkshire Together, which was the name of the project to build a new Royal Berks. We've got a lot of new housing with a lot of pressures on primary care, and it doesn't look like we're going to get anywhere near a new hospital in the foreseeable future, i.e. the next decade. And it just says it's on hold. I'm conscious that the current chief executive for the Royal Berks is leaving quite soon. It'd be nice to get his view before he left on how the Royal Berks is going to cope over the next decade with things like Hall Farm. You won't build 2,800 houses in the next decade, but you might well build another 1,000. So could we get that perhaps onto the agenda for March, because he's going to leave fairly soon?
Adrian, do you know any more than we know? As a governor.
I must be honest, I didn't attend. There was a meeting today which I unfortunately couldn't attend. But I think I would not make it a personal thing. I mean, whether Steve's there or not, the organisation will continue on its direction. I think it's fair enough to invite RBH to present their current thoughts on the expansion of housing in this area and how they can support that. But that the actual person delivering the message, I very much doubt would be Steve.
Just follow it up. Yeah, because also we've got somewhere I saw, oh yes, on the current unscheduled topics, RBH waiting lists. They're not going to get any shorter over the next 10 years if we don't do something fairly dramatic.
At the last Bob meeting, there was discussion from Bob about balancing waiting lists across RBH, Heatherwood and Frimley. So the message that I personally took from that was that, you know, because the trusts are being brought together, there's going to be more sharing, load balancing. So that question is not just the RBH waiting list, it's the Bob waiting list, effectively.
Just to go on a little bit from what Adrian said, when we both went to joint Bob POS together, it came across very clearly that the focus was not on a new RBH. It was, they are obviously having to rebuild Frimley because of the rat concrete problem. And there was absolutely no indication, because you actually brought it up, I remember you asking a question about it, that they have any intention. To be honest, he came away from it thinking, it's just not going to happen. It really came across quite clearly that the focus is on Frimley and that there will be local regional centres, smaller centres. It was very clear that there was no focus at all on rebuilding RBH to be the kind of hospital that everybody wants. Whether it will be rebuilt in a different guise, in maybe a smaller centre or whatever, but it was quite clear that they were not focusing on that at all.
I don't think any of us are surprised at that, really, are we? With what's going on. Yeah. On page 62, we've got some items on there for this year, and that's the coroner's service, and a briefing about the ICB planning about assuring healthcare provision and the growing population, which is what Mike just said. And I think perhaps we need to look at those a bit more urgently than we've got them on here. So can we think about how we can handle those, please, and bring some news into us? The post-mortem thing's been on there for 18 months probably now.
So this is off the back of when we had the last update from the coroner service in September. So it was that you have a further update in the new municipal year. I think I might have put it the wrong. I put 25-26 and I meant 26-27. So that will be perhaps quicker than you.
Because Berkshire is a complete outlier with regards to the whole of the UK in terms of its ability to deliver non-invasive autopsies. The request at that meeting was, well, firstly, the coroner service said that they were in planning to improve that because, you know, I think we achieved something like 34%, and most places in the UK normally do about 70 or 80%. So we're way down on everywhere else in the UK. But they were going to come back and talk about their plans to improve that. And also there is still the outstanding question of what is the cost or potential cost to residents where for perhaps religious beliefs or something like this, they want a non-invasive autopsy, and they may be presented with a bill for that. So the coroner's service agreed at that meeting to come back in whenever and furnish that answer. Because for me personally, I can't imagine a family that's lost a person in really unexpected circumstances and who would be, you know, in trauma effectively, being given a bill if they request a non-invasive autopsy. I can't imagine that situation. So I sincerely hope that they do come back with an improvement plan and that they do come back with that information. Thank you.
I think, I mean, this is our last meeting of this municipal year, but I think we ought to pick that up next year. And in the meantime, leave it with the staff to see what they can sort out. Is there anything else anyone wants to say?
Just thinking from our meeting in, I believe it was September 25, when we had the new CEO of Optalis and the commissioner here talking about the movement of Westmead, which, you know, we were all really pleased to hear about. And they wanted to come back and give us an update. And they suggested something quite soon. And I thought we said we'd like to have them back in 6 months' time. So, but I'm not seeing any mention of that recorded. Because I hope we'd all like to hear that it's settled in very well. But love to hear something now, Wes.
I was said commissioner with Helen Woodland. So we are scheduling, it's not on there, and I'll pick up with Madeline. We have a Q3 stakeholder, shareholder report, which will need to be scheduled in, and we're going to do those regularly so they align with all the council's companies. So we will need to bring that forward, and that will be a regular item, hopefully. But I'm happy to talk specifically about Westmead, etc.
Thanks, Wes. Thank you very much. Nice to see everyone. Have a safe journey home, and I hope it's not raining.